Hello, thank you for visiting my channel, Medical Assistant with Miss K. If this is your first time here, thank you for checking me out. I am a medical assistant and medical office assistant instructor, and this channel is just all about medical assistant and medical office assistant. So whether you are already in school or thinking about going to school, or maybe you fresh out of school, or maybe you've been out of school for a long time and you just need some refreshers, this channel is for you. So if you watch this video and you decide you want to see more from me, go ahead and make sure you subscribe. So today I'm going to be talking about the differences between encounter forms and claim forms. Why? Because I'm noticing that people are getting them mixed up. I'm noticing that with my own students, and also from doing these study sessions live and having people participate, I'm noticing that people are getting these forms confused. So I'm just going to share a couple of them, and I want to talk about some differences because you need to know the difference. First of all, working in the field, you need to know, these are the forms you're going to be working with. And then also, when you go to take the certification exam, you're going to have some questions about encounter forms and claim forms, especially if you're on the administrative side. So you need to know, you need to know the differences between the two. So we're going to look at a couple different encounter forms because encounter forms are specific to the practice that you'll be working for. And you'll see what I mean in a moment. They pretty much all look the same. However, the codes are going to be different because the codes are going to be most commonly used codes by that specialty. Okay. And so that's actually one of the definitions of an encounter form. It's a form with commonly used codes. Okay. Commonly used diagnosis codes and commonly used CPT codes, right? Another way it may be defined as, another name for a super bill. Another way is defined as pre-printed, a form with pre-printed um, codes on it that the provider fills out to, ensure a clean claim form. Well, actually, not a clean claim form, but a clean claim. And a clean claim just means that it's a claim free of errors. It means that all of the codes are correct, all of the information on the claim form is correct. And how do we do that? By making sure we have an encounter form filled out. So encounter forms have pre-printed codes. These codes here is a level of care, CPT codes. Now, this is what determines how much the provider is paid. What are CPT codes? Those are procedure codes. That is what tells the insurance company what was done, right? Diagnosis codes tell the insurance company why. Now, diagnosis codes, they do not determine how much a provider is paid. However, it does tell the insurance company why they are paying for this service, right? So let's look at this. So these are some CPT codes. A level of care indicates whether the patient was new or established, the length of time, even the age of the patient, right? So this indicates what type of visit it was, the diagnosis codes. We're not going to get deep into this information on these forms. I just want to make sure you all understand the difference between the two. We can get into filling out a claim form and how to do that and things like that. But I want to kind of make this quick and just make sure you understand. So that way, when you go take the certification exam and they're asking questions, you know the difference between the two, right? And so if you watched my channel before, you know that I focus on the CCMA exam and the CMAA exam. However, even if you're going to take the RMA or the CMA, this is information you need to know either way, so this is for you as well. Okay, so let's look at this. So again, this is a family practice form. So this is going to have broader CPT codes. It's going to have broader diagnosis codes. Now, the encounter forms, they pretty much look the same, but you'll see a lot more codes and stuff on an actual encounter form. This is a fillable form I found on PDF Filler. For the most part, these forms are like carbon copies because we'll need 3 copies. We'll need a copy that goes with the patient, 1 copy stays in the office, and then another copy goes along with the claim form. And excuse that noise if you hear it in my background. There's something riding past outside. Okay. So they usually a carbon copy, right? Okay. So anyway, the codes, mention the CPT codes, diagnosis codes are here. And again, this is family practice. So these codes are going to be kind of broad. Okay. So you have checkup codes and what else? We have cough, back pain, chest pain, pharyngitis, pneumonia. Look how broad these codes are, because this is family practice. Family practice, they can see mom, they can see dad, the children. Some family practice offices even see, they even deliver babies. It's so broad. HIV, hypertension, and then any codes that are not already pre-printed, the doctor or provider will check off here, and then they will write that code and they'll add that code in. And then here, immunization. So if the patient received the immunization or any laboratory tests that were done will go here, and then the provider will sign and date it. And then we use this information to fill out the claim form. Now before we look at the claim form, let's look at one more encounter form, because I want you all to see the difference in how encounter forms are specific to the specialty. Notice those codes were broad, as I mentioned before. Now this is an OBGYN encounter form. So these are going to be pre-printed codes, more specific to GYN visits. So again, the level of care codes are up here. These CPT codes I would determine how much the doctor is paid. This is why it's so important to make sure you have the correct codes, because you don't want to bill for a 15-minute visit if the doctor actually spent 60 minutes with the patient. Okay. So providers, for the most part, they will fill these encounter forms out, but there may be some instances where you may have to figure out the codes on your own and use the CPT manual or ICD-10 manual to find the codes. But for the most part, in a perfect scenario, the provider already has filled this out, and all you have to do is transfer it to the claim form. But anyway, so as you can see here, these diagnosis codes are more specific to GYN. So you have well care, cancer screening, contraception, menstruation, GYN, pregnancy, postpartum. So notice the difference. Same type of form. It looks the same, but the codes are different. So wherever you work, you'll notice the form those codes will be specific to that office, to that practice, okay? And then laboratory tests, and again, the provider will sign and date it. So this is the encounter form, okay? Pre-printed codes that we use to fill out the claim form. Now let's look at the claim form. As soon as we pull this up, you'll be able to see the difference. This is why it's so important for you all to, look these forms up. Do like I did. I literally just went on Google and looked up sample forms, okay? Familiarize yourself with it. If you familiarize yourself with these forms, you'll be able to answer certain questions. Now, with this form, we're not going to get too deep into this. The main things I want you to look at when you're looking at this claim form, and first of all, I want you to familiarize yourself with it, period. But for this video, for the purpose of this video, what I want you to focus on again is just looking at it, noticing the difference between the two. There is nothing pre-printed on this claim form. So if you see a question and it's asking about a form with pre-printed codes on it, a lot of people choose claim form. But if we look at this, that can't be the answer, because there's nothing pre-printed. It is blank. Everything that goes on here, we have to actually write it in. So once the provider gives us that encounter form, all of this information for the patient, demographic information, insurance information, we'll fill all that out. And then the codes that the provider has indicated will transfer it here. So the diagnosis code. So this is one important thing to look at, because you may see a question. I know for a fact one of the questions on the CMAA exam asks how many diagnosis codes can fit on a claim form. And as you can see here, by familiarizing yourself with it, you see up to 12 can fit. One primary diagnosis code and then 11 secondary codes. You always want to list the primary code first. That's the main reason a patient was seen. You always list that first. Okay. Another question you may see, how many CPT codes can go on the claim form? As you can see here, up to 6. Okay. Now, another question you may see, what is a modifier? What does a modifier do for a CPT code? It explains unusual circumstances. Now, you know this just by familiarizing yourself with this form. So this is why I wanted to show you all this, because just looking at it, you'll know the difference. Okay. The data service here is where you indicate what data service, what date the service was completed, right? The place of service is another important one. POS code That is an exam question. It'll ask, what is a POS code? It's a place of service code that indicates where the service took place. Was it in a provider's office? Was it in a hospital, at the patient's home, or wherever? Okay. So, I can do a later video, in the future, talking more about how to fill this out, but it's pretty easy. As I mentioned, the biggest thing I wanted you all to take away from this is to just be able to recognize the differences between the two. The encounter form, or AKA super bill, it's another name. Super bill is another name for the encounter form. We use that to fill out the claim form. So if you see questions about, what is a form that, we need to fill out to ensure a clean claim. A clean claim is a claim free of errors. We know it's an encounter form because the encounter form tells us all that we need to know for that claim. It gives us all the codes we need, okay? As long as the provider has filled it out. That's the perfect scenario. The provider has filled it out. So I hope that this video was helpful. Again, go look online, search up some sample claim forms and encounter forms, and just become familiar with it. So when you see it on a certification exam, you're able to answer those questions. One other thing I want to point out just quickly before I end this video, NPI number. They do ask whether NPI number has to go on a claim form, and as you can see here by looking at it, we know that it does. What's the NPI number? The National Provider Identifier. That's that 10-digit number that the provider is assigned. That's the identifier number. So as you can see here, yes, it does need to go on a claim form. Again, the importance of familiarizing yourself with these forms. So I hope that this is helpful. As always, if you have any questions or video suggestions, feel free to leave it down below. You can email me. I'll leave my email in the description box. If you enjoyed this video and if it was helpful, go ahead and like it and subscribe to this channel if you haven't already. Again, thank you for visiting my channel. Be blessed.